What is the prognosis or natural history of lateral ankle sprains? So, largely, these get better very quickly. So, within the first 2 weeks, pain rapidly resolves in the large majority of individuals. And these stats are kind of crazy to me. The average time to return to sport after lateral ankle sprain is 16 to 24 days. If you look at NCAA athletes, in 44% of the lateral ankle sprains, athletes return to play in less than 24 hours. So half of folks are getting back to sport right away within 24 hours. In 3.6%, the athlete required more than 21 days before returning to play. So around 96% of folks are getting back before 3 weeks. Okay. And that's a good thing. So largely folks get back relatively quickly and it doesn't take too long. A few people take 3 weeks or more, but not that many. I know I'm harping on this like crazy, but up to 40% of these injuries become chronic ankle instability or recurrent sprains. And here are some kind of interesting stats I picked up. So at 3 months follow-up, let's say you have a lateral ankle sprain and they're looking at your ankle 3 months after the injury. 65% of participants reported instability. 24% reported one or more resprains. At 12-month follow-up, 55% still reported that same instability, and greater than 50% regarded themselves as not completely recovered. At the 1 to 4 year follow-up, 5 to 46% of patients still experience some sort of pain. 3 to 34% of patients experience recurrent sprains. So they had another ankle sprain. And 33 to 55% of patients reported instability. At the 2.5 to 5 year follow-up, clinical symptoms of anterior ankle impingement were present in 25% of all athletes. So what does that mean? So largely when these athletes try to dorsiflex their ankle, they'll have some sort of painful pinching or restricted range of motion in the front of the ankle. Can't tell you how many athletes I've worked with that sprained their ankle at some point in the past, and now they feel kind of blocked in the front of the ankle, kind of painful, pinchy sensation in the front portion of their ankle. Okay. There was radiologically confirmed tibio-talar osteophyte bone formation in 82% of these athletes. So after you have a lateral ankle sprain over the course of time, this leads to a sequelae of events where your body starts to form some bone in the front portion of the ankle. And this leads to those symptoms of anterior ankle impingement. Okay. Now, it makes sense if we can reduce some of this by doing a really good rehab program, we should. But our research isn't robust enough to tell us if we do rehab after someone has ankle sprain, if we'll actually reduce some of these issues in the future. So if you are loving what you are learning right now, I highly recommend you check out my Fitness Pain-Free episode where we go over a patellar and quadriceps tendinopathy guide. I will leave a link in the show notes. Definitely recommend checking it out. You can also click on the link right above if you're watching this on YouTube and get started watching right away.